What's up, guys? I'm Kristen at the Lactation Mentor. I'm a board certified lactation consultant, and I'm going to teach you how to measure your flange size for your pump. This is something that you should do during pregnancy to have this prepared. You should also get your insurance covered breast pump during pregnancy and have the flange sizes ready in case you do need to pump after birth. Yes, both nipples can be different, and yes, unfortunately, you do have to buy third-party flanges for most pumps because most pumps come standard with a 24mm flange, which is usually too big for people. Although the gold standard is measuring with a metal caliper, most of us aren't going to do that at home. So one of these silicone measuring tools is like $3 on Amazon, super easy and accessible to use at home without training. There are some newer studies that are saying to measure the tip of the nipple versus what we've done in the past is measure the base of the nipple and add a couple millimeters for your flange size. I'm kind of falling somewhere in the middle of these recommendations. My clients are finding those flanges are comfortable and have good milk output, but everybody's going to be different. So I'm going to give you my perspective. Number one, you need to measure. The 24mm is too big. Started with like a 17, too big. 15, still a little big. I don't want any wiggle room. I want to know the exact size of my nipple. What about 14? So 14 seems to be the exact size of my nipple. I don't have any wiggle room. This does go down to the base. Now, if you are following the guideline of starting to just measure the tip, I would do more of like a 13mm for this nipple, and you can try both and see what's more comfortable. We only want the nipple going into this flange tunnel. That is why we're measuring the exact nipple size. If the areola and breast tissue is coming into this flange tunnel, that is too big. It can cause pain and damage, but it also won't result in as good of a milk output. This is a 13mm insert and a 24mm flange. And even this is actually a little bit too big. I think this breast probably needs like an 11 or a 12. See how some of that areola and breast tissue is still going in. We really just want the nipple. But the biggest indicator of what the right flange size is isn't look, it's comfort and milk output. Comfort is number one. If you're having discomfort with pumping, try lubricating the flange tunnel with some nipple butter or some coconut oil. And if you're still not sure or you're having pain, not having good pump output, please see a lactation consultant. We can absolutely help you with this.